Welcome to the Deep Dive. Today we're tackling a topic that might seem a bit specialized, but it's really vital for anyone involved with dogs and cats.
Absolutely. It's crucial stuff.
We've been looking at some source material, an excerpt called Canine and Feline Penile Disorders. Our goal here is to, well, unpack the key details about three specific conditions: phimosis, paraphimosis, and priapism. We want to give you a clearer picture of what they are, the signs, the causes, and importantly, the treatments based on this source.
It's definitely an area where knowing the signs early can make a huge difference. These aren't just, minor issues. The outcomes can be quite serious depending on what it is and how quickly it's handled.
Exactly. So let's dive in with the first one from our source, phimosis. What are we talking about here, basically?
Okay, so phimosis, in simple terms, is when the animal just can't protrude its penis. It can't extend it beyond the opening of the prepuce, which is, the sheath covering it. So it's essentially stuck inside. And the source mentions something about certain breeds being more prone to this. It did, yeah. That's a key point. Congenital phimosis, meaning they're born with it, is seen particularly in German Shepherds and Golden Retrievers.
Oh.
And the source even suggests it could be hereditary in those breeds. So that's definitely something for breeders and owners of those dogs to be aware of.
That is interesting, the breed link. So if an animal has phimosis, what would you actually, see? Is it always obvious?
Not always, no. It might honestly go completely unnoticed until, say, someone tries to breed the animal and finds it's impossible.
Right.
But in more severe cases, especially in very young animals like neonates, the defect can actually block urination.
Okay, blocking urination sounds like a major red flag. What happens then?
Well, that's where the problems really start. It can cause urine to pool inside the prepuce. And this isn't just harmless pooling.
No, I imagine not.
Exactly. The source is quite clear this can lead to something called balanopustitis. That's inflammation of the glans, penis, and the prepuce.
Inflammation, okay.
And in really bad situations, it can even escalate all the way to septicemia.
Septicemia. You mean like a full-body infection?
Precisely. A life-threatening bloodstream infection. So it can get very serious very quickly from what seems like just a physical issue.
Wow. That connection isn't immediately obvious, is it, from not being able to extend the penis to potential septicemia?
Yeah.
So what actually causes the opening to be too small?
The main issue is usually just an abnormally small preputial orifice, the opening itself. This could be congenital, like we said, born with it, or it could be acquired later on from things like an injury or maybe chronic inflammation scarring it.
Okay.
The source also brings up another possibility, a persistent penile or preputial frenulum.
A frenulum, what's that?
Think of it like a small band of tissue that connects the penis to the prepuce during development. Normally it breaks down, but sometimes it doesn't. It persists, and it essentially tethers the penis, preventing full extension.
Ah, like it stays connected when it shouldn't. So when vets are trying to figure this out, beyond just looking, what else do they check?
Well, interestingly, the source notes that your standard blood tests, your CBC, biochemistry, or analysis, they're usually normal.
Oh, yeah.
Unless you've got those serious complications like the balanopustitis and septicemia we mentioned, especially in young animals. In that case, you might see signs of infection in the white blood cell counts, maybe bacteria in the urine, but often the diagnosis comes down to the physical exam and the history.
Right, makes sense. Primarily physical unless it escalates. So how do they fix phimosis?
Treatment is typically surgical. The goal is to surgically enlarge that preputial opening so the penis can protrude normally.
Okay.
And if it's caused by that persistent frenulum, specifically in dogs, the fix is pretty straightforward, surgically cutting that connecting band of tissue.
That actually sounds less complicated than dealing with septicemia. What's the outlook usually?
The prognosis, according to the source, is generally fair to good. But that's if it's caught and treated before septicemia develops.
Ah, the timing is critical again.
Absolutely. It really drives home how important it is to notice those early signs, like difficulty urinating or any inflammation down there, especially in puppies and kittens.
Makes total sense.
Yeah.
Okay, so phimosis is about being stuck in. Now, let's flip the script. Paraphimosis. This is the opposite problem, right? Stuck out.
Exactly. Paraphimosis is defined as the penis being exteriorized, it's out, but it cannot be retracted back into the preputial sheath. It's stuck outside.
And this happens in both dogs and cats?
Yes, the source confirms it occurs in both.
Okay. What are the warning signs for this one? Is it always immediately dramatic?
Not always, right at the start. If it's very recent, maybe the only thing you'll notice is the animal licking persistently at the exposed penis.
Licking. Okay.
But here's where the urgency really kicks in. After just a few hours of being stuck outside, exposed, really serious damage can begin.
A few hours? Really?
Yes. The source mentions ischemic necrosis, that's tissue death because the blood supply is cut off. And it can even block the urethra, causing urethral obstruction so they can't urinate.
Wow. Tissue death and inability to urinate. That sounds incredibly painful and like a massive emergency.
It absolutely is. And as all that swelling happens, the edema, it can actually make it quite difficult just by looking to tell if it's paraphimosis or the third condition we'll get to, priapism. They can look similar when very swollen.
Right, that complicates things.
Yeah.
So what causes the penis to get stuck out like that in the first place?
It's often associated with erection or mating. That's the usual trigger. But several things can predispose an animal to it or cause it directly. Our source actually lists quite a few possibilities.
Like what?
Well, things like preputial hair, the fur around the opening, can get tangled and trap the penis, especially that swollen part in dogs, the bulbus glandis.
Ah, the hair itself.
Yeah, or maybe a preputial opening that's a bit narrow, even if not narrow enough to cause phimosis. Injuries, of course. Fractures of the bone in the dog's penis.
Oh, there's the mo. Okay.
Yep. Also, certain neurologic diseases are listed, like encephalomyelitis or even disc disease on the back. Belinoposthitis, that inflammation we talked about earlier.
Right. Penile swelling from other causes, like, say, a tumor, or if something like a rubber band or hair ring gets wrapped around it, causing strangulation, or even just weakness in the muscles that are supposed to pull the prepuce back over the penis.
Wow, okay, that is a surprisingly long list of potential reasons. So if a vet sees this, what else do they need to rule out?
Good question. The source mentions differential diagnoses. It could be confused with just exposure of the glans penis because of issues with the muscles, or maybe a very large preputial opening or a short prepuce naturally. And as we said, distinguishing it from priapism is really key.
And this is where that urgency factor comes in again really strongly. Our source emphasizes immediate treatment is required for paraphimosis.
This is probably the single most critical point for paraphimosis. The source states very clearly that after just 24 hours of the penis being trapped out, the tissue damage and potential urethral blockage might be so bad that penile amputation becomes the only option.
Amputation within 24 hours. That time frame is honestly terrifying. It really is. It just underscores how incredibly fast you need veterinary intervention.
Absolutely. So the immediate goal is just get it back in.
Exactly. The primary aim is to replace the penis back into its normal position within the prepuce. This might involve placing an indwelling urinary catheter if they're worried about urethral patency.
Making sure they can pee.
Right. Removing any trapped hair or foreign objects, lubricating the penis really well, and applying compresses soaked in hypertonic glucose solution.
Hypertonic glucose. Why sugar water, essentially?
Yeah, it sounds a bit strange, but it works through osmosis. The really concentrated sugar solution helps to draw excess fluid, the edema, out of the swollen tissues.
Oh, okay. It shrinks the swelling.
Exactly. It makes it less swollen, hopefully enough to allow reduction. If a narrow opening is part of the problem, surgery to enlarge it might be needed, similar to phimosis treatment. And the source also mentions a procedure called philopexy, has sometimes been successful, that's basically surgically tacking the penis in place to prevent it from coming out again.
Interesting. And the source specifically says castration doesn't help paraphimosis.
Correct. It's not a hormonally driven issue, not testosterone dependent, so removing the testicles won't fix the mechanical problem of it being stuck.
Okay. So given how bad it can get so quickly, what's the outlook for an animal that's had paraphimosis?
Well, the prognosis is considered guarded to poor if the goal is returning to breeding. There might be permanent damage. However, the prognosis for the animal's life is generally fair to good, but that relies entirely on prompt and successful treatment, whether medical or surgical.
That early intervention again, it's everything.
Absolutely everything in preventing that irreversible damage.
Okay, so we've got phimosis stuck in, paraphimosis stuck out. Now the third one, priapism. How is this one different?
So priapism is defined as a persistent erection lasting a long time that is not associated with sexual arousal. The source specifies this means an erection lasting longer than 4 hours.
4 hours.
And characteristically, the bulbus glandis, that erectile part at the base in dogs, is firm and swollen.
So an erection that just won't quit for hours with no obvious reason like mating. Is this a common thing?
It's actually relatively uncommon in dogs, and it's considered rare in cats, but there's a really interesting note in the source about cats.
Oh, yeah.
It mentions one report where 6 out of 7 documented feline cases occurred in Siamese cats.
6 out of 7 were Siamese. That is specific. any idea why?
The source doesn't elaborate on the why, unfortunately, but it's a striking observation, a potential predisposition, perhaps.
Definitely something to note. So the main sign is that persistent erection, not linked to arousal. Anything else?
Yeah, the duration over 4 hours is the key time frame, and that firm, swollen bulbus glandis. And like we touched on with paraphimosis, the swelling, the edema can sometimes make it visually tricky to distinguish between the two initially.
Right, the swelling masks things. What causes an erection to just stay like that without arousal? What's the mechanism?
The source explains it usually boils down to one of two things. Either there's excessive nerve stimulation telling it to stay erect, that's the parasympathetic nervous system, or more commonly, there's a problem with blood drainage. The blood flows in, but it can't get out properly from the erectile tissue, the corpus cavernosum.
Okay, so it's like a plumbing issue. Either the on-tap is stuck open or the drain is blocked.
That's a great analogy, yes. And the source further breaks down the causes into two main types based on blood flow: non-ischemic or high flow, and ischemic or low flow, also called veno-occlusive.
High flow and low flow.
Yeah.
What's the difference in terms of causes?
Okay, so for non-ischemic high flow priapism, think trauma, maybe certain drugs that affect blood vessels, vasoactive drugs, neurologic issues, and interestingly, canine distemper virus is listed here.
Distemper, wow.
Yeah. For ischemic low flow priapism, where blood is trapped in stagnant causes, could include trauma during mating, chronic neurological problems, perhaps linked to distemper again, blood clots in the penis, thromboembolism, amphetamine use, tumors in the penis, or even abscesses nearby in the perineal area.
That's quite a mix.
It is. And frustratingly, the source notes that often the specific underlying cause is never actually identified. It also mentions causes seen in humans, like sickle cell disease, blood disorders, dialysis, certain drug therapies, spinal cord injuries, even anesthesia or blockage by bladder stones. While these are human issues, they hint at the kinds of systemic problems that could potentially be involved.
That's a really wide range of possibilities, from trauma to disease to drugs. Sounds complex to pin down.
Yeah.
Given it can look like paraphimosis and it has all these potential causes, how do vets diagnose priapism and figure out if it's high flow or low flow?
Well, one thing to rule out, mentioned as a differential, is just urethral obstruction from stones, because that can cause straining or dysuria, which might be noticed alongside the persistent erection. But the really key diagnostic tool, highlighted in the source specifically for differentiating the types of priapism in dogs, is penile blood gas analysis.
Penile blood gas? You mean testing the blood from the erect penis itself?
Exactly. You take a sample of blood directly from the corpus cavernosum, and it gives you incredibly valuable information.
How so?
The source gives the specifics. Ischemic blood, the low-flow stagnant kind, will have a low pH, meaning it's acidic, less than 7.25, very low oxygen levels, PO2 under 30 mmHg, and high carbon dioxide, PCO2 over 60 mmHg. That tells you the tissue isn't getting fresh blood.
Okay, that makes sense. Starved of oxygen.
Right, whereas non-ischemic high-flow blood will have a more normal pH, around 7.4, high oxygen, PO2 over 90, and low carbon dioxide, PCO2 under 40. This shows blood is flowing through, it's just not draining adequately.
That blood gas data sounds absolutely critical for figuring out what's actually happening physiologically.
It really is. It fundamentally guides the next steps in treatment.
Are there other diagnostic tools they might use?
Yes, ultrasonography can help visualize the blood vessels, see if they're engorged. And because neurologic or spinal issues can be a cause, a full neurologic exam, maybe x-rays, or even an MRI might be done to check the spinal cord.
So signs, that crucial blood gas test may be imaging. How is priapism treated then? Is it also an emergency?
It is definitely an emergency, especially the ischemic type. Aspirating blood from the penis, which is how you get the sample for the blood gas test, can actually provide some temporary pain relief too. So it's diagnostic and can be briefly therapeutic.
Ah, okay.
However, a really sobering point from the source is that it's often impossible to figure out the underlying cause before significant ischemic damage, that tissue death from lack of oxygen has already happened.
So again, like with paraphimosis, time is absolutely critical and irreversible damage can happen very fast.
Unfortunately, yes. Because of that potential for irreparable ischemic necrosis, the source states that penile amputation, often paired with creating a new urinary opening, perineal urethrostomy, is frequently required.
Amputation again. That seems to be a common outcome for the severe cases of both paraphimosis and priapism.
It is, sadly. And again, like paraphimosis, castration is noted as not being an effective treatment for priapism itself.
Right. What about for the rare cases in cats?
For cats with priapism, especially if they're having trouble urinating, the source indicates the same approach. Penile amputation and perineal urethrostomy are the treatments.
Are there any other measures tried before resorting to amputation?
The source does mention a couple of things. An abdominal compression bandage and maybe an indwelling urinary catheter can help manage swelling and keep the penis inside the prepuce temporarily.
Okay.
And specifically for ischemic priapism, it mentions trying intrapenile injections of a drug called phenylephrine, diluted in saline.
Phenylephrine.
Yes.
Isn't that a vasoconstrictor used in decongestants?
It is. The idea, presumably, is to try and constrict the inflow or encourage outflow. However, the source adds a significant caveat. There aren't really any medications generally approved or proven safe and effective for this in veterinary medicine.
Got it. So it's maybe an attempt, but not a guaranteed fix.
Right. And antibiotic ointments might be used just for maintenance to prevent infection or stop the penis from sticking to the prepuce. But again, with that same note about lack of specific approval or proven efficacy.
Understood. So given the potential for such severe outcomes and the frequent need for amputation, what's the overall prognosis for priapism?
It mirrors severe paraphimosis, really. The prognosis for returning to breeding function is guarded to poor, but the prognosis for the animal's life and general well-being is fair to good, assuming timely and successful management, even if that involves amputation. The focus shifts to preserving life and urinary function.
Okay, so let's just quickly connect the dots here. We have phimosis, paraphimosis, and priapism, all involving the penis and prepuce, but really distinct problems, right?
Exactly. Phimosis is about the opening being too small, maybe leading to infection if urine pools. Paraphimosis is the mechanical emergency of being stuck out, leading super fast tissue damage if not reduced. And priapism is that persistent, non-aroused erection, often a blood flow issue, also carrying a high risk of irreversible ischemic damage very quickly.
And as you mentioned, the severe swelling in both paraphimosis and priapism can make them look quite similar initially. So that diagnosis part, especially the blood gas for priapism, is crucial.
Absolutely. Telling them apart accurately is key because the underlying mechanisms and sometimes the specific interventions differ.
But the huge common thread, particularly for paraphimosis and ischemic priapism, is just how incredibly fast things can become critical. Hours matter.
That is the single most vital takeaway from our source material on these conditions. Recognizing any abnormality is important. But understanding the signs pointing towards paraphimosis or priapism means recognizing a true, time-sensitive emergency. Delay can literally mean the difference between saving the organ and needing amputation.
We've covered phimosis, paraphimosis, and priapism definitions, signs, the sometimes surprising causes, and the often urgent treatments.
Yeah, it's heavy stuff, but really important information for pet owners and vets alike. Not everyday conversation, but potentially life-saving knowledge.
Definitely. And considering those severe potential consequences we discussed, ischemic necrosis, the need for amputation if treatment is delayed, it just powerfully underscores how vital it is for people to recognize those early signs and seek veterinary care immediately. It's not just about preserving function, but sometimes truly about preserving life itself.